Welcome back, guys. Now in this video let's discuss about oxygen hemoglobin association dissociation curves. Okay, now what we are saying, oxygen and hemoglobin, sometimes oxygen is getting associated with the hemoglobin and sometimes oxygen is getting dissociated with the hemoglobin. Now before that, let me ask you one question. Oxygen or hemoglobin molecule, okay, let's start with the hemoglobin molecule. Hemoglobin molecule will love to bind with oxygen or it will love to release the oxygen. My question to you, hemoglobin molecule, it will love to bind with the oxygen or it will leave the oxygen, love to leave the oxygen? Just tell me. Most of the students will say something like this, hemoglobin molecule loves to bind with the oxygen, sir, but that's false. Both are true. Hemoglobin at the level of lungs, where high partial pressures of oxygen is there it will love to bind with the oxygen. Wherever the partial pressure of oxygen is less, especially at the level of tissues, their hemoglobin molecule will leave the oxygen. It will leave the oxygen to the tissues. Okay. Now let's see, the concept is, sir, wherever the partial pressure of oxygen is more, in those conditions hemoglobin love to bind with the oxygen. So the percentage saturation of hemoglobin is more. So more association. Wherever the partial pressure is more, hemoglobin will love to bind with the oxygen. So more association with the oxygen. When the partial pressure of oxygen, if it becomes less, in those conditions there will be more dissociation of the oxygen from the hemoglobin molecule. More dissociation means less saturation of the hemoglobin molecule. So same was written here, that is, whenever partial pressure of oxygen increases, then hemoglobin saturation will also be more association. And if partial pressure of oxygen decreases, the association will be less, automatically hemoglobin saturation will go down. Now let's discuss about what is this oxygen hemoglobin association dissociation curve, what is P50 value, what is happening in the right shift and what is happening in the left shift. So now let's start like this, okay, with here. At high partial pressures, what we have discussed, at high partial pressures, hemoglobin loves to bind with oxygen. True, at the level of lungs, high partial pressure is there, it will love to bind with the oxygen, hemoglobin loves to bind with the oxygen. Now see, what is the partial pressure of oxygen at the level of lungs? At the level of lungs, the partial pressure of oxygen is 100 mmHg. Remember, the partial pressure of oxygen is due to dissolved oxygen. Now when the partial pressure of oxygen is more, hemoglobin is how much percent saturated? 100% saturated. Please look at this graph. Okay, here, this is the partial pressure of oxygen. When the partial pressure of oxygen is 100, see, now what is the percentage saturation of the hemoglobin molecule? On the x-axis, I am showing you the partial pressures of oxygen. On the y-axis, I am showing you the hemoglobin saturation. Okay, now this blue color curve is a normal curve. Blue color curve is a normal curve. This this green color dotted curve is a right shift. It's a right shift. Okay, please make a correction. It's not a left shift. It is a right shift. Okay, it's a right shift. The green color curve is a right shift and the purple color curve, which is more towards the left, that's a left shift. Right shift will occur, left shift will occur. Okay, we'll discuss about the right and left shift later, but right now just stick to the basics. The basics is at the level of lungs, in the arterial blood. Okay, in the arterial blood, what is the partial pressure of oxygen? In the arterial blood, the partial pressure of oxygen is 100 mmHg. When the partial pressure of oxygen, if it is 100 mmHg, now what is the percentage saturation of the hemoglobin? See, now the hemoglobin molecule is almost 100% saturated. 100% saturated. Now, at the level of tissues, please concentrate here. Please follow this line. At the level of tissues, the partial pressure of oxygen is 40 mmHg. Now, if it is 40 mmHg, now what will happen? Oxygen is, one molecule of oxygen is delivered to the tissues. So what should be the percentage saturation of hemoglobin molecule? The percentage saturation of the hemoglobin molecule is 75%. Now please look at the graph. See, now at the level of tissues, the partial pressure of oxygen is 40 mmHg. Now please look at here. Now see, it is 75% saturated. Okay, it is somewhere around, see, at this line, right? Okay, let me show you with the red thing. See, now at the level of tissues, okay, see, at the level of tissues where the partial pressure of oxygen is 40 mmHg, Hemoglobin is how much percent saturated? This area, right? This one. This is the mark. It is somewhere around 75% saturation. So 75% saturation means one oxygen molecule is delivered. So I can say if you decrease the partial pressure, hemoglobin is getting desaturated. One oxygen molecule is getting delivered to the tissues. If you decrease the partial pressure by, like from 100, you have brought it down to 40. So there is a wide change in the partial pressure, but only one molecule is delivered. Only one molecule of oxygen is delivered. So hemoglobin is 75% saturated. Okay. Now, the same, see, the partial pressure of oxygen is 100, hemoglobin is 100% saturated. At the level of tissues, the partial pressure of oxygen is 40 mmHg, hemoglobin is 75% saturated. Okay. Now, let's talk about the right shift. Okay. But just wait, before discussing about the right shift, now let's talk about a value called as P50 value. What is a P50 value, sir? The partial pressure at which hemoglobin is 50% saturated. Okay, 50% saturated. Now, let's talk about the hemoglobin saturation, this axis, like the y-axis. On the y-axis, see, here is the hemoglobin saturation, 50% saturation. Now, let's say, draw a dotted line like this. So, what is this dotted line? This dotted line is showing us 50% saturation of the hemoglobin. Now, in a normal healthy individual, he is not doing any extensive work, normal, he is a normal guy at rest. Now, see, look at here, guys. What is the partial pressure at which hemoglobin is 50% saturated? See. Now, let's draw it with the red color line. See. Like this. Now, it will be somewhere around 27 mmHg. So, what is this 27 mmHg? If you bring the partial pressure of oxygen to 27 mmHg, the hemoglobin saturation will become 50%, which means 2 oxygen molecules are delivered. Now, imagine that there is this one hemoglobin molecule, which is occupied by 4 oxygen molecules. 4 oxygen molecules are sitting. Okay. Now, if you want to remove one oxygen molecule, how much pressure you have to decrease? How much you have to decrease the partial pressure? You have to decrease the partial pressure of oxygen from 100 to 60. Sorry, from 100 to 40. From 100 to 40. Okay. So, you have brought down the partial pressure of oxygen from 100 to 40. Now, one oxygen molecule is delivered. Okay. Now, from 40, you again brought it back to 27 mmHg. At 27 mmHg, one more oxygen molecule is delivered. So, the partial pressure at which hemoglobin is 50% saturated is called as P50 value. In a normal individual, what is the P50 value? The P50 value is, sir, 27 mmHg. That's it, 27 mmHg. Now, let's see what is this right shift. Okay, what is this right shift? Right shift is also called as low affinity state. In the name itself, it's very clear, low affinity, which means hemoglobin is not loving to bind with the oxygen. Now, hemoglobin, how it is behaving? Hemoglobin is behaving in such a way, it is readily giving up the oxygen. It is readily delivering the oxygen very easily. Okay, so low affinity. Now, what is the concept of this right shift? Now, just think logically. Whenever you are doing exercise or whenever you are running a marathon race, you are running. Now, when you are running, your tissues require more oxygen or not? Yes, your tissues require more oxygen. Whenever there is more basal metabolic rate in your body, okay, now your tissues are requiring more oxygen. Now, in these conditions, hemoglobin will behave in such a way that it will easily deliver the oxygen to the tissues. Instead of delivering one oxygen molecule, it will now deliver 2 oxygen molecules. When the demand is more, like when the oxygen demand is more, now what hemoglobin will have to do? Hemoglobin will have to easily deliver the oxygen to the tissues. That's what will happen. See, this right shift, okay, right shift, the green color dotted line, the right shift is going to be seen in exercising conditions. Exercising conditions. Whenever you exercise, what happens? There will be right shift. Now, please look at here, guys. Okay, please look at here. Normally, when the partial pressure of oxygen is 100 mmHg, hemoglobin is 100% saturated. Okay. In a normal individual, when the partial pressure of oxygen is 40 mmHg means, please look at the blue color line, blue color thing. When the partial pressure of oxygen is 40 mmHg, now hemoglobin is 75% saturated. But my question to you, now look at the left shift. Now look at the right shift. Now at this 40 mmHg partial pressure, now it's the same 40 mmHg partial pressure, hemoglobin is how much percent saturated? At 40 mmHg partial pressure, hemoglobin is 50% saturated, which means how many molecules are delivered to the tissues? 2 molecules. In a normal person, if the partial pressure of oxygen is 40 mmHg means, how many molecules are delivered to the tissues? 2 molecules are delivered to the tissues. Now in this person who is doing exercise, now what this hemoglobin is doing? Instead of delivering 1 oxygen molecule, now for the same partial pressure 40 mmHg, it is delivering 2 oxygen molecules. Hemoglobin is now 50% saturated. So this is low affinity. Hemoglobin is easily giving up the oxygen. Now why this is happening, sir? Now why hemoglobin is behaving differently? Why means something is getting changed inside the hemoglobin. Now whenever there is an exercising, whenever there is an exercising muscle, if the patient is now demanding more oxygen. Now what will happen is, sir, in the body more carbon dioxide is produced. There will be hypoxia in the body. Okay, more protons are produced inside the body, that will cause low pH or acidosis. When the person is exercising, there will be more temperature inside the body. There will be production of 2,3-bisphosphoglycerate in the RBCs. Now all of them will bring the changes in the hemoglobin in such a way. Try to understand. All these conditions will change the structure of hemoglobin in such a way, now it will easily give up the oxygen. For the same partial pressure, instead of delivering only 1 oxygen, now it will deliver 2 oxygen. That's why it is just 50% saturated. Okay, so remember here, affinity for the hemoglobin for oxygen is decreased. So more oxygen molecules are delivered to the tissues. Okay, now for every given partial pressure, hemoglobin is less saturated. Okay, more oxygen is getting delivered to the tissues. This is something really good. When there is more demand, more oxygen need to be going to the. Now after this, let's talk about the P50 value. P50 value, already we know what is the P50 value. The partial pressure at which the hemoglobin is 50% saturated. In a normal person, the P50 value is 27 mmHg. Now what is happening to P50 value in right shift? Please look at here, guys. See, this is the P50. This is the P50 line. Okay. Now what is the partial pressure at which hemoglobin is 50% saturated? In a normal person, this is 27 mmHg. But in a right shift curve, see, in a right shift curve, the P50 value is 40 mmHg, which means P50 value is increased. In right shift, P50 value increases, sir. Exactly is the opposite thing. In left shift, okay, in left shift, P50 value decreases. That we will discuss. Okay. Now, before that, let's talk about the left shift. Left shift is an example of high affinity state. Okay, left shift is an example of high affinity state. For example, when the basal metabolic rate is very less, when the body temperature is going down, simply think like this: you are going into very cold area, area where your metabolism is coming down. Your tissues are not doing any metabolism. No metabolic activity is happening. Okay, when temperature decreases, your body metabolism will come down. When the metabolism comes down, now what is the amount of oxygen that is required by the tissues? Less oxygen is required by the tissues. So now tissues are not requiring oxygen. Tissues are not demanding oxygen. When demand is less, hemoglobin, what it will say? So you don't want oxygen, I won't deliver oxygen. So whenever oxygen demand is less, now hemoglobin is behaving in such a way, it won't deliver the oxygen easily. It will keep the oxygen with itself. So this left shift is going to be seen in those conditions where the metabolism comes down, or in those conditions where the temperature is less, your body metabolism is coming down. See, when the temperature is less, or whenever there is alkalosis in the body, or when the proton concentration decreases, or when the carbon dioxide concentration decreases in the body, in all these conditions, hemoglobin structure will change in such a way it won't deliver the oxygen. Now let's see the graph here, guys. See, here this purple graph which I am showing you, this one is the left shift. Okay. Now what is happening? Please concentrate. at 40 mm Hg partial pressure, in a normal person, at 40 mm Hg partial pressure, hemoglobin is 75% saturated. In right shift, hemoglobin saturation comes to 50%. But please concentrate in left shift, hemoglobin concentration is almost 90 or even 95, okay, till this area. Which means not even one molecule is delivered. If one molecule is delivered means 75% saturation. Here the saturation is 90 or 95, which means not even one molecule is delivered. Okay, so oxygen is not getting delivered to the tissues, or hemoglobin is not leaving the oxygen. When tissues doesn't need oxygen, it won't leave the oxygen. So this is what is happening in the left shift. Left shift is high affinity state. So what is happening to the P50 value? The P50 value in left shift decreases. In left shift, P50 value decreases. Now please look at here. This is the P50 line. Okay, this is the P50 line. Now what is the normal P50 value? The normal P50 value is 27 mm Hg. What is the P50 value in right shift? The P50 value is coming more, 40. Now what is happening to the P50 value in left shift? It is less. P50 value decreases. P50 value decreases. Okay, so in this slide we have discussed all the important points regarding oxygen association dissociation curve and how the oxygen association curve changes in right shift, left shift, and what are the conditions in which the patient is going to have, the person is going to have right shift in the oxygen hemoglobin association dissociation curve, and the conditions where there is a left shift in association dissociation curve. Hope the video is helpful. In the next video, we'll discuss about the carbon dioxide transport. Thank you.